Well, I had dinner with many of our doctors in Los Angeles last night, and in anticipation of having this conversation, I was asking them, why did you join TBH? And one of the things that came up many times was this sort of a feeling of trust that seems to come from the transparency that we have as a company. All of the doctors are aware of the salaries that other doctors are paid, the benefit package. There's a one-size-fits-all principle for doing the same kind of work. And we also show the doctors our books in terms of they know exactly how much our customers are paying for the service. And I think that that has people feel that there's something a little bit unique about TBH. The diversity of the opportunities, I think, also is a reason. And the congruence between pre-hire statements and the post-hire job experience. We are very obsessive about saying specifically to a doctor what the job will involve, how many patients you'll follow, what time does the workday start, what time does the workday end, what are the requirements for documentation, so that when people arrive at the job, they have a really strong sense of what the experience is going to be like. And this comes from an experience that I have where I'm always talking with physicians that are in some kind of transition in their life. Either it's a young doctor coming out of residency, or a doctor later in life moving out to California. And there's a lot of anxiety for people when they're contemplating taking a new job. And I think that perhaps one of the things that we do that is helpful for people is that we try to reduce that anxiety by providing the doctors with a lot of information about what is in the job. And we don't sugarcoat the pieces of the job that are challenging. I find doctors to be very forgiving about the hard parts of jobs as long as you've been clear with them about exactly what the expectations are. If somebody shows up at a job the first day and there's a congruence between what you've said and what they experience, it's going to be a much more pleasant experience for them. If they look around them and see other psychiatrists who are there to do their job and they're not being asked at the last minute to cover for two doctors, they're going to feel much, much better and much more looked after. There's no diversity in terms of the type of patient or client that we work with. Everybody is seriously and persistently mentally ill. The top 1% of consumers of mental health services, most likely to be in the hospital, most likely to be in the emergency room, most likely to be homeless, most likely to be using street drugs. So for the doctor who's looking for a more of a kind of a worried well type of patient, TBH is not a good fit. Within TBH, though, we have acute inpatient services, average length of stay, 8 treatment days. Doctors are following about 12 patients. We also have psych ER, 3 shifts a day through the night also. We have a new service which is an urgent care environment where somebody can walk in today and say, I have missed my appointment with the county and I can't get in to see the psychiatrist for 3 weeks, can I have my medication refilled today? And that is a sort of a prophylaxis, if you like, against the possibility of being in a psych ER in 4 or 5 days from now. So we have that, and then on the outpatient environment we have standard outpatient kinds of jobs, and then assertive community treatment programs where doctors are seeing 6 patients a day. They're out in the community, they're seeing people in their own home environments, and they're truly meeting the client where the client is at. I think that the opportunity to be able to stay as an employee of one company with the same employer, the same health insurance plan, the same retirement plan, and to maybe have 2 or 3 significantly different jobs in a decade is probably a significant factor, because we don't lose people who feel like that they're not as fresh as they were doing the work that they're doing. Oftentimes we give them an entirely different opportunity that is animating for them. People say to me that the milk of human kindness begins to dry up if you do the same work week after week, year after year. And we can freshen the doctor's experience in ways that maybe other companies can't. And I think a piece of that is we're not trying to take the square peg and wedge it into the round hole. What our job is to do is to find the match that's really going to work for this individual psychiatrist. We have infinite quantities of work, so it's not the shortage of work that will drive us. It's the opportunity to create something that's very unique for this doctor, that will have this doctor come and will have this doctor stay.